Okay. You ready?
Yeah.
Good afternoon, everyone. My name's Kelvin Malazzab, and I'll be teaching to you about oral care.
Yes.
So our aim today is to define and demonstrate the importance of oral care. Our learning outcomes are, by the end of this session, should be able to discuss the importance of oral care, identify the risk associated with poor oral care, and demonstrate the correct procedure for oral care. So, the importance of oral care. Well, firstly, the definition for oral care is the practice of keeping the mouth, gums, your lips, your teeth, and dentures clean. Our mouth it's important to keep our mouth clean because it is vital for when we eat, drink, chew. Yes, which is part of eating, but yes, well done.
Thank you for that.
Yeah, I'll
Eat
take notes.
cheese extra.
Communicate and with others. So oral care also helps prevent infections. By maintaining patients' oral hygiene is essential as it is a part of our nursing duty and is considered as a fundamental aspect in nursing. So the benefits of keeping our mouth clean is it improves relationship, patients' appetite, as they will be able to taste the food and drinks, and promote self-esteem and comfort. The diseases associated with poor oral care sorry, is gingivitis, halitosis, dental caries, stomitis, cheilitis, and xerostomatitis.
What was that?
We'll focus on oral candidiasis, or commonly known as oral thrush. So oral thrush is a common fungal infection in the mouth. This type of fungus is
Perfect.
which is usually found in our mouths and in our digestive systems. Oh my god. And does not usually cause any problem until they multiply. So a person with oral thrush will normally complain of a burning sensation in their mouths and throats, and their mouths will also look red and inflamed. The medication used to treat oral thrush is nystatin. So the main causes of oral thrush are the patient has been taking long-term antibiotics, long course of antibiotics, having a poor fitted dentures, having a dry mouth, and if they have taken chemotherapy or radiography for cancer. The risk factors that increases the likelihood of this disease are age, condition, medications, mental health, if they have any disability, and their diets. So your role as a healthcare professional is to prompt patients and carry out their
How many slides have you?
prompt care, 60, to carry out oral care after meals, after they vomited, in the morning and night time. You should also provide the correct equipment and ensure that privacy is kept by closing the curtains if they are in the bed. Now, also assist patients who are unable to carry this out for themselves. You should also educate patients and advise them and refer patients if it's needed. So before you provide any oral care, you must first do an oral care assessment. This should be, it's important to do this to be able to provide a baseline of how the oral cavity was beforehand, monitor the treatments and how it's improving, and you can also, by doing this, you can also identify any new problems occurring. Next page. So the equipment you need are toothbrush, toothpaste, mouthwash, dental floss, water, emollient, lead Vaseline. So the oral care procedure is first you'd have to ask for consent and explain what you're going to do. Wash your hands using the 8-step technique. Wear your apron or gloves, and then you can assess the mouth. You ask the patient to sit upright and then assess the mouth. That's it. Then you apply a pea amount of toothpaste in the toothbrush and clean the inner outer biting surfaces of the teeth. Then after this, you can also gently brush the gums and the surface of the tongue. Then you give them water to rinse their mouth to moisten it. If the patient is unable to tolerate this, you can just give them mouthwash instead. Use tissues or a hand towel to dry their mouth and apply any emollient if they have any cracked lips. So how often is it given? Oral care should be done every morning, night time, and after they vomited and after meals. It can also depend on the assessment tool and the patient's individual circumstances. There is a lack of evidence which shows the frequency of oral care. However, plaque buildup and gingivitis has been identified after 2 to 4 days.
What is gingivitis?
Gingivitis is when you give gingerbread buns.
What?
Gingivitis is... I'll come back. So now that is done, we'll quiz and test your knowledge. What is one cause of oral thrush?
Dry mouth.
Yeah. What medication is used to treat oral thrush? Yes. What must you do before providing any oral care?
Oh, gain consent.
No.
I don't
Let's
know.
do an oral care assessment. What must you do before providing any type of oral care?
Assess.
Do an oral care assessment.
Do oral care.
Plaque buildup and gingivitis has been identified as after how many days?
4 days.
2 to 4
2 to
days.
4 days.
So to recap our learning outcomes, you should now be able to discuss the importance of oral care, identify the risk associated with poor oral care, and demonstrate the correct procedure for oral care. Any questions? No, thank you.
Thank you.
So how long you
And this is the
You're gonna be like a director or something.
okay. Thank you.
That's really good.
Oh,